السلام عليكم ورحمة الله. معاكم دكتورة صابرين، أخصائية في جراحة الوجه والفكين، وعندي الدكتوراه في نفس المجال. طبعا أنا راح أتكلم باللغة الإنجليزية. وإن شاء الله لو عندكم أي أسئلة راح أحط الإيميل تبعي في آخر المحاضرة. Today we are going to discuss the definition and scope of oral and maxillofacial surgery. And as I said, I'm Dr. Sabrin Ali Azim. I have a PhD in oral and maxillofacial surgery, and I'm associate professor in UAE Medical University. Before going to the actual lecture, I would like to appreciate those who invited me to be a part of this interactive session today. Of course, الدكتور محمد الشعيبي رئيس مجلس أمناء جامعة خليج عدن، وطبعا شكر خاص للدكتور نجيب الشعيبي رئيس الجامعة، وشكر خاص فعلا للدكتور محمد العامري رئيس قسم الأسنان. I really bothered him a lot and he helped me so much, and I think you students should be also appreciating his efforts. Let's go ahead and understand what are the learning outcome. When I say learning outcome, it means that what is our expectation from this lecture today and what we are going to discuss. Basically, we need to understand what is the role of oral and maxillofacial surgeon in the healthcare system. Because today when we say a dentist and oral surgeon, we need to highlight their critical role in multidisciplinary healthcare systems, as well as their impact overall the patient's care. Second thing is to identify the scope of oral maxillofacial surgery. It has a unique scope of oral maxillofacial surgery. It focuses on how it differs from other dental specialties. So when we compare, for example, orthodontist, oral surgeon, let's say prosthodontist, so it all has a different specialty and different aim, of course. And the achievement of the result, of course, is different. Evidence-based practice, we will highlight the importance of evidence-based practices, ensuring that the treatment are rooted in the latest research, that whenever we decide to create a treatment plan, it should be very individual, but it should also depend on the research, recent informations, of course, and definitely we need to consider the needs of our patient, of course. So when we look at this child, we can see on the picture that there is a child that is smiling, but we all need to understand that there is a story behind the smile. Even if we look today at our lives, none of your professors, none of your colleagues or students, friends know what is actually you are going through, right? So this child actually is smiling today, but he was born with the cleft lip and palate, as you can see on this. Let me have a pointer here on the lip, right? So basically, oral and maxillofacial surgery is where the art meets the science, as I stated, and it will combine the precision of advanced surgical techniques with the compassion and empathy needed to transform the patient's life, as we can see here from one picture to another picture as well. All right, so we need to highlight that this specialty not only restores the function. So dear students, when someone will be telling you that oral surgery is only about the function, no, we do look at the quality of life of the patient. So basically, it also will rebuild confidence in patient and hope, and it will give a hope for our patients, of course. Right? Let's go to the next slide. And now we are coming to the actual lecture, where we are going to discuss the definition and scope of oral surgery and insights from a global perspective. Means that when we say a global perspective, we need to consider, for example, how WHO, تمام. Is defining oral maxillofacial surgery. So according to WHO, oral surgery encompasses the treatment of both congenital conditions, like before I showed you cleft lip and palate, and acquired conditions such as trauma or tumors in the maxillofacial region. Then we have a Patterson's perspective. Now, all of you should know that the book that, or the best references, or one of the best references for oral and maxillofacial surgeons is Patterson. In fact, me personally, I love the book of Dr. Professor Balaji that I actually shared through your head of department to you. So when we look at the Patterson's perspective, what he thinks about the surgery, who is a leading authority, as I said, he emphasized oral surgery's critical role in surgical management of disease affecting the maxillofacial area, showcasing the blend of dental and medical expertise. So when we look together, oral surgery is far more than a series of procedures that we were thinking about. It's a commitment for diagnosing and surgically management, or managing the complex conditions with the precision and excellence. So here we will say that this specialty, oral and maxillofacial surgery, uniquely integrates medical and dental knowledge. So when you will look at the oral maxillofacial surgeon, you will find that he will always have a combined knowledge of, of the medical or of the medicine and the dentistry as well, right? Because we go through the rotations of, let's say, ICU, reanimations, anesthesiology, and etc., traumatology, many other rotations as well. Okay, so basically it will address the functional and aesthetic needs, as I said, transforming patients' outcomes. Let's go to the next slide. Now, honestly speaking, before defining any specialty or going into the depths and understanding where it reached, we need to know where it started from, right? So here we need to know that why oral surgery matters. As I said, it's a unique, of course, discipline where precision in surgical techniques meets compassion in patients' care. So basically, all our aim is to achieve the goal, to enhance the patient's life, to enhance the patient's functionality, speech, and etc., whatever will be related to the diagnosis at that moment. Okay. Now, if we look here, so we will see that we have, let me take just the pen. Okay. We will have here the, let's go back, restoring of the function, right? Then we will have here the enhancing of the quality of life and its contribution to the global health. So oral surgeon has a pivotal role, right? It plays an integral role in healthcare systems globally, addressing critical conditions from managing facial trauma to performing life-changing reconstructions and different areas as well. By the way, you can see here two professors on this picture or this slide. There are pioneers of oral maxillofacial surgery, such as Norman Rowe, Dr. Norman Rowe, renowned for his work in facial trauma, and Dr. Daniel Laskin, a leader in TMG disorders, which is also very popular nowadays, as you might know, and laid the foundation for the advanced practices we follow today. So their contribution reminds us that oral surgery is not only about the procedures, but also about the restoring lives with empathy and the skills that we are need to have. Okay, let's see over here. So we have the historical evolution, right? So the journey of oral surgery is a testament to centuries of innovations. So where we reach today, we need to understand that it is a progress of a very long time. So it's a resilience as well. And as I said, it's a progress. So we have the key milestones. If we look here at this slide, we will see that, let's look here. So the early history of oral surgery began from 500 BC to 300 BC. And the famous Greek physician Hippocrates, you know, nowadays, even when the students graduate in some country, they will give a Hippocrates oath, right? So it described the manual reducing dislocation of the mandible, for example. So imagine how many years back they were thinking about it, right? We have here a gilt as well. And then we have here barbers. Um, 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 a guild of barbers, and he was created in France and split into two groups: surgeons for more complex operations and the surgeons for simpler procedures. Maybe you will think that it's like dividing oral maxillofacial surgery into minor surgeries or the major surgeries today, right? We have also the Pierre Fauchard, who wrote a treatise called The Surgeon Dentist. You can read about it if you wish. And the earliest man to be designed as an oral surgeon was Simon Houlihan. As I say, the key milestones here would be Ambroise Paré in 16th century, and he was known for his early surgical techniques, and Harold Gillis craniofacial reconstructions during the war, and evaluation of cleft lip and palate surgery through the decades is also considered to be a milestone here. Okay. I'm sorry, let's go back. So basically, we have gone through the key milestones. We spoke about the Ambroise and the Harold Gills, and we understood that one of the key milestones as well would have been the evolution of cleft lip and palate. The understanding this history is not just about honoring the past, but it's also about recognizing the creativity, resilience, and dedication that define our specialty, and that's inspiring our future as well, right? Now, going back to what I was planning to discuss is the evolution of oral maxillofacial surgery. So when it actually started, when was the deep roots of the necessity where the oral maxillofacial surgery born out, right? So normally what happens is that there is a necessity, there is a need, let's say, and then the challenging circumstances. If we think about the necessity and the challenging circumstances, especially many years back, the first thing will come to our mind is the war, right? So when we say a war, one of those that played an important role in oral and maxillofacial surgery would have been the Second World War. And there was a contribution, particularly from the Harold Gillis, the one that we discussed earlier. You should know that he is also known as the father of modern, by the way, even though we are talking about the history, but he is known as the father of modern plastic surgery, developed groundbreaking reconstructive techniques to manage severe facial trauma among the soldiers. So it is actually justifying why we are saying about the World War, and how it contributed to the progress or evolution of the oral maxillofacial surgery. It has an impact on the modern practices. The advancement that were made during those times led to the foundation for many of the technique and principles that we practice in oral and maxillofacial surgery. Again, understanding our history is essential. It reminds us of the resilience, creativity, our dedication to address the complex clinical challenges that will define today our specialty as well. When I say our, of course, I do consider you as future oral maxillofacial surgeons. So if we look at the collage of the First World War facial injuries, now we can see here, let me see if I will be able to get my pointer or if you can see it or no, but let's see here. There is the patients, a lot of soldiers, in fact, right, who has traumas. Let us zoom this area. Yes, we can see here the traumas, right, on this picture. Then we can see the Harold Gillis was a New Zealand surgeon who had trained in England and posted to France in 1915. And he witnessed the rise in horrific facial wounds inflicted by this new style of warfare. So when he came back to England, Gillis set up a special ward for the facial wounds at the Cambridge Military Hospital in Aldershot. And he even sent his own casualty labels to the field hospitals in France to make sure that men with such injuries, as you can see on those pictures or on the slide, were sent directly to him. So by 1916, Gillis had actually, let me go back, persuaded his medical chiefs that a dedicated hospital for facial injuries was required to meet the demand. Going to the practice, so there is a Queen's Hospital, and the aim of the Queen's Hospital was to reconstruct wounded men, as you can see, men's faces as fully as possible. So basically, not only one part, right, but they would like to address the whole maxillofacial region, right? As I said, as fully as possible, so that they could hopefully lead back to a normal life after the injuries that happened to them during the war. So what I say that it's not about only functionality, but basically maxillofacial surgery is also addressing the quality of life, as I said. So here, if a patient would come back to his family and beloved ones after the surgery in a better way, so of course it would affect him and his family members positively as well. So Gillis knew that the healthy tissue, right, needed, of course, to be moved back to its normal area or to the normal position, as we can see on the second picture. So after this, any gaps could be filled with the tissue from elsewhere, from any other place. So you can see here is the rotated flaps as well, that he can place it in the area which is not present, right? So surgeons already had a degree of experience with the skin grafts by that time. And after the work had been completed on the bone structure of man's face, they were ready to reconstruct the soft tissues. So what we understand that surgery, it approaches each area step by step, layer by layer, and depending on the emergency, of course. Skin grafting, one of the most successful skin grafting techniques was to release and lift a large flap of the skin called a pedicle, right, from near the wound. So as close as it's possible to the wound. And it will be still connected to the donor side. The free end of skin flap would be then swung over the site of the injury, as I mentioned earlier. So without completely severing the connection to the body. So it would have maintained the physical connection, ensuring that there is a blood supply to the skin, right? That will increase, of course, the chance of the graft being accepted by the body. So yes, this is how it would look like. Let me zoom this area as well so you can see. So basically they are taking in from this area and placing it closer to the wounded area, right? Okay. This is a video. I hope we will be able to play it and you will be able to see then what it is about.
One of the things that the First World War presented to the medical establishment here in Britain when the soldiers returned was a depth and scale of facial injury that hadn't been seen before. Shrapnel caused tearing and jagged edges in wounding, which presented a particular challenge because of infection. Shrapnel dragged in soil and dirt from the trenches into the wounds, and infection was one of the biggest challenges that doctors faced afterwards. Surgeon Harold Gillies established an establishment to deal solely with facial injury at Sidcup. And the teams there were faced with a whole new range of injuries and needed to provide surgical innovation on a quite a rapid scale. They devised a method where living tissue was attached to the face from the neck and the chest, and the fact of living tissue being attached to the face as a graft meant that infection was mitigated drastically, and patients could be kept alive in a relatively well state. And it's something that's gone on to influence us right to today with plastic surgery and the rise of facial reconstructive surgery that's happened in the 20th century since. We don't have in our collection an object which so significantly represents that moment of plastic surgery advent that happened in the First World War. So we partnered with the Royal College of Surgeons to have a look at their collection and think about how we could interpret here in the museum some of that story. We chose this wax teaching aid and worked with Inspirational, the production company, over the last couple of years to really get a facsimile version that we can use here at the museum. Because the technology is still in development, we went back and forth on scanning, rescanning, getting the colour values really correct with Inspirational, and have produced a really wonderful facsimile version of the Royal College of Surgeons teaching model.
So basically seeing a million times over the video is of course not giving us exactly the same as when you will be able to touch it, to see it face to face. However, I did not see it as well. So thanks to the students of the Jamat Khalid Aden for giving me as well the opportunity to watch this video. Now, you will hear one day about the father of Indian surgery, Sushruta. As I said, he will be called as the father of Indian surgery because he revolutionized ancient medicine with his innovative techniques and profound contributions. So let me zoom it for you. This is how he's called, and here we can see basically the Sushruta Summit. I'm not sure if I'm pronouncing it in a correct way. Let's call him as the father of Indian surgery. So practicing in 6th century, he compiled the Sushruta Samhita and encyclopedic text that serves as one of the earliest detailed accounts of surgery medicine. So basically he pioneered the rhinoplasty. His expertise in rhinoplasty was particularly notable. Developed into response to punitive nose amputations in ancient India, and his technique led to the groundwork for modern reconstructive surgery. So emphasizes on the anatomy and the tools. He also highlighted the importance of detailed anatomical knowledge, and he introduced over 120, if I'm not wrong, surgical instruments, showcasing a sophisticated understanding of medical science for his era. So Sushruta also emphasized the ethical responsibilities of practitioners' guidelines that remain remarkably relevant even today itself. and his work exemplifies the timeless nature of knowledge and its enduring impact on global medical practices. What we need to remember is that Sushutra's teachings remind us that the principles of innovations, ethics, as I said earlier, and the dedication transcend time, forming the foundation of the surgical excellence. Perfect. So as oral and maxillofacial surgeons, our achievement today stand on the shoulders of centuries of innovation, dedication, and perseverance by those who came before us. We need to be appreciative for them. Historical foundation, it's easy to take today everything for the granted, and people actually got used to it. And here we are talking about the modern tools, techniques, and technologies we use daily. But those advancements were built on the visionary efforts of pioneers like, as I said earlier, Sushruta, who introduced, for example, early surgical techniques, Hippocrates, who established the foundation for ethical and logical medical practices. So modern innovators fast forward to the 20th century, and the legends like Dr. Harold, Dr. Norman, advanced techniques in managing facial trauma. So if we combine all of it together, we can see where we are today. Those individuals faced challenges. It actually shaped the specialty we practice today. Their work reminds us that we are not just the surgeons, we are torchbearers of a legacy that continues to evolve with every innovation. So you will say that our lecture was about the scope of surgery, but studying this kind of journeys instills humility and inspires us to contribute to this field in ways that will benefit future generations of the surgeons and patients. Of course, that will result a successful outcome for the patients as well. So we have already mentioned that how Patterson defined oral and maxillofacial surgery, how WHO defined that. And we said that oral surgery plays a vital role in diagnosing, managing diseases, defects, and injuries, as you can see over here, right, within the oral and maxillofacial regions. Okay. Now, if we go to the next slide, so basically let's look here. This slide will illustrate for you the hierarchy and the progression of the general dentist or the dental specialization, highlighting the increasing complexity and scope as we move from general dentistry to the pinnacle of oral and maxillofacial surgery, or we can say as OMFS, right? So if we examine each level in detail, starting from the general dentist, at the foundation is a general dentist who is responsible for the diagnosing, preventing, and managing basic oral health needs. And they act basically as an gatekeepers, often identifying conditions that requires referral to the specialist. In fact, they play a very important role. So basically, if you are a very good dentist, you can prevent the complications that might happen in future by identifying the problem on time, right? And if necessarily, by knowing your limitations, then you will be able to refer it as well on time and achieve a better results for the patient. So oral surgeon, what you can see on the next one, a specialist trained to perform surgical procedures such as, let's say, complex extractions, implant placements, and management of the minor pathologies or minor surgeries. Their focus is primarily on the oral cavity, and it involves additional training beyond the general dentistry, as I said. Then we have a craniomaxillofacial surgeons or oral and maxillofacial surgeons, right? So we would say the craniomaxillofacial surgeons expand the scope further by addressing the entire craniofacial region, as we can understand. Their expertise includes managing complex trauma, congenital anomalies like cleft lip and palate, and head and neck oncology as well, which is different in different countries. In some countries, we have limitations and restrictions. In some countries, no, it goes directly under the scope of craniomaxillofacial surgery. Again, you need to consider the local authorities, Ministry of Health, and etc. Okay, oral and maxillofacial surgeon at the pinnacle is the oral and maxillofacial surgeon, a dual qualified specialist who bridges the dentistry and the medicine and addresses the complex conditions of the oral cavity, as we said earlier, but it does not limit their phase and jaw, including orthodontic surgery, TMG disorders, advanced reconstructive procedures as well. So we can see the progression here, right? So starting from general dentist, going to the oral surgeon, oral and maxillofacial surgeon, and the highest would have been here, the maxillofacial surgeon, right? So this progression not only reflects the diversity of the field, but also underscores the advanced training and interdisciplinary knowledge required as we move towards the oral and maxillofacial surgery. So as I said, here we have the pathway that demonstrates the specialization and advanced training that is required to manage increasingly complex cases in oral health and surgery. So importance of the specialization as we progress through its hierarchy, it becomes clear how education, experience, and interdisciplinary collaboration are vital in achieving the excellence. So relevance, as I said, relevance to the practice, understanding the structure not only highlights the diverse roles but within the dentistry, but also will underscore the commitment required to address the functional and aesthetic needs of patients. So here we will have a call to action, right? So the progression reminds us that continuous learning and collaboration across the discipline are a key to advancing patient care and achieving impactful results. Let's go to the next one. So there are certain procedures that should be performed only by the specialist. So we see here the roots displaced into the maxillary sinus, orthodontic surgery, transplantation of the tissues, oral oncology, and all what you can see in this area. Complicated maxillofacial surgeries and infections, difficult impactions, and etc. So as I said, oral maxillofacial surgery is vast, covering everything from routine procedures to the life-changing surgeries, right? So it will include routine extractions, minor surgeries, which form the foundation of the specialty. Then if we go to the advanced end of spectrum, oral maxillofacial surgeons manages craniofacial conditions that might require orthodontic surgery or head and neck oncology interventions. Yes, basically, as we can see here. Let's look here in the details. So we can see here, for example, the impacted tooth, and here will be required the surgery to remove impacted teeth. So is it supposed to be done by a dentist or by the surgeon? Definitely, it is supposed to be done by a surgeon. In addition to that, it's even more complicated in case if the patient is a compromised patients or medically compromised patients, because here you need to make sure that you address the medical condition as well. Bone grafting or pre-prosthetic surgery in order to prepare the patient for the future prosthesis is also a part of the surgeon's specialty. What if we will have patients, for example, with, as you can see, with head and neck squamous cell carcinoma, Then we can have here also, let's zoom it in. The medication-related osteonecrosis of the jaw, of the mandible post-cancer treatment for multiple myeloma with the long-term intravenous biphosphonate use. Right, so all of this will be also a part of oral maxillofacial surgery. So the diagnosis and treatment of benign pathology, cyst tumors, and the head and neck oncology is as well important. We have the cranio maxillofacial trauma, as we discussed earlier. So it is considered to be among the most critical and complex aspect of oral maxillofacial surgery, involving the injuries to the bone, to the bones, maybe even teeth and soft tissues, as we could see in previous slide. By the way, it can happen due to different reasons, such as acute injuries, could be by the road accidents, if the patient will fall down, if there is any violence, for example. So the trauma type will differ from range from the fractures to soft tissues injuries and the dental avulsion as well. So here, initial assessment is very important, prioritizing the airway and cervical spine stabilization. Imaging, like we can see here, for example, computer tomography scan will be very crucial, because it will help us also to understand the or to be able to diagnose which areas are being involved after the clinical examination, of course. On top of that, we need to address also the malocclusion or asymmetry with the reconstruction techniques, and the psychological support is very important as well. In majority of case scenarios, interdisciplinary approach is also very important. So sometimes you will need to call the ENT as well, neurosurgeon and psychologist for the comprehensive care, right? So it isn't just about fixing the bones, right? It's about restoring the quality of life through the collaborative efforts and holistic care as well. We have something that is called orthognathic facial orthopedic surgery and treatment. So as we can see, those surgeries will correct the jaw of facial skeletal discrepancies. It will improve both the function and the aesthetics, the malocclusion will be addressed as well, right? On top of that, the patient will be able to breathe better, to chew better. The malocclusion will be addressed, as I said. Sometimes patient might have the sleep apnea as well. So asymmetry will be addressed as well. Or maybe the patient might have a cleft lip and palate, for example, and the deformities related to that, right? So this will be a part of the addressing. What is very important here is to ensure that not only the surgery, but the post-operative care ensures stability. It should benefit from all, from all areas, as I said earlier. By the way, here you can see the braces. So basically, there will be a collaboration of orthodontist, oral maxillofacial surgeon, ENT, since I said that maybe the breath will be involved as well, and speech therapeutists who will be collaborating on the same case and working together. So this fusion of the science and artistry transforms lives, as I said. We have also surgical and non-surgical management of the temporomandibular joint disease and disorders. So basically, we will have here, this is the temporomandibular joint disorder. So sometimes your patient might say that they are having a teeth grinding, trauma. So the temporomandibular joint is a highly complex structure enabling essential functions like speaking, chewing, and facial expressions as well. So TMJ disorder vary in severity from mild discomfort to debilitating conditions that significantly impact the quality of life, which we discussed in the beginning of this presentation, right? So it will need effective management. It's very important to have the tailored approach. When I say tailored approach, it means that يعني ما نعالج كل المرضى بنفس الطريقة. لا، المفروض كل مريض and يكون العلاج متخصص لهذا المريض بالضبط. فهمتوا؟ So this will ensure both functional and patient-centered outcomes are being achieved. Okay, so we have here surgery and treatment of congenital abnormalities, including clefts of the lips and palate. I need to ensure that, first of all, this is being understood by you, the cleft lip, right? And cleft palate, as you can see. Let me zoom it so you can, it will be clear for you, right? So this is the cleft lip, and here is the cleft palate as well. So it will represent the most challenging and impactful conditions treated in oral and maxillofacial surgery. First of all, because it will affect more than one area and more than one function, right? By the way, I am pretty sure that you know that this will be an incomplete fusion of facial structures during the embryonic development and will require a multidisciplinary approaches because it needs a comprehensive care. So when I say multidisciplinary approach, basically I need to know that it will involve not only on oral maxillofacial surgeon who will definitely lead the surgical intervention, but a pediatrician is very important because he will be able to manage the preoperative nutritional and general health, speech therapist for the future who will be ensuring the phonation development post-surgery, ENT specialist, of course, that will be addressing the recurrent ear infections that might happen and hearing deficits, and orthodontist اللي هو دكتور أخصائي التقويم who will be aiding or helping in future in alignment and of the dentition. So so we will not be only restoring the form, but also the function. It's about giving patients and their families a renewed sense of hope and a better quality of life, which we agreed with you that هذا هو الأيم تبعنا. تمام? So through advanced techniques and collaborative care, we can continue to transform our patients' lives. It's very important to understand that the patient-centered decision making prioritize the clinical excellence, while you know, when I have to respect, of course, let me keep it like this, patient's desire, right? I need to respect patient's values and his preferences as well. So I give him always the options of treatment. It involves shared decision making between the patient, family, and the healthcare team, ensuring they are very well informed about the treatment options. So you can go with this treatment, you can go with another treatment. Sometimes instead of extraction, we can save tooth if the patient came on time. So interdisciplinary collaboration with the pediatrician, speech therapist, and psychologist is the key to holistic care. Also, it's very important to consider the importance of the consent form. The consent form should be given to a patient not only for the signature, but before asking the patient to sign this document, we need to explain to him the risk and benefits of the particular surgery, or in case if we don't proceed with the surgery. We need to make sure that we address all the questions of our patients' parents in order to achieve the best recovery, best decision for the patient. Because, you know, when it's patient-centered approach, it will improve the satisfaction, of course, compliance, it will help in trust, and making the patient an active participant in their own recovery. In this case scenario, of course, since the babies are small, so their parents will play an important role. So how did actually oral surgery evolved? So methods used in the ancient times, I'm not sure if you have seen it earlier or no, but the modern era of oral surgery is characterized by precision, right? Innovation and collaboration. So let's see here. This is the modern era of oral surgery. So nowadays we have an amazing anesthesia, right? Antiseptics. So basically anesthesia is of course helping for the procedure to be done in the best way for our patients, as well as it will reduce the uncooperativeness from our patients during the surgical procedure. That will allow us to continue performing our surgery and complete it in the best way. Antiseptics as well are very important. So basically modern era of oral surgery brought the less painful experience for our patients, right? Antiseptics, antibiotics nowadays reduce the risk of the infections as well. So as I said, the development of modern tools and instruments such as lasers, for example, we have endoscopes, we have also the 3D imaging or 3D printing, virtual surgical planning, robotic assisted technique. It all have revolutionized the complex procedures. Oral surgeons today manage not only dental issues, but also trauma, orthodontic surgeries, a lot of different areas, as I mentioned, right? So it's very important to be aware of the cutting edge tools achieving the functional and aesthetic outcomes with remarkable accuracy, because those innovations enable us to go beyond treating conditions. We are transferring lives. Don't forget about this. So we have the advancement in oral surgery techniques. So oral surgery has evolved significantly due to advancement in technology and surgical anatomy. So basically we can say that impossible is possible nowadays, right? Let us see what we have here as well. So for example, when we say impossible is possible, so we can do the jaw reconstructions. Let me go here. Bone grafting tissues, right? Tissue regeneration as well. We have the minimally invasive techniques. So piezoelectric surgery, TMG, arthroscopy, it all will minimize the damage and scarring for our patients. What else? Let's go down and try to open the next one. Yes. So we have here as well the recent advances such as 3D images or 3D printing and virtual planning. This will enable custom implants and precise execution for orthodontic and reconstructive surgeries as well. When we say regenerative medicine, so growth factors, PRP and stem cells enhance the bone regeneration and healing, isn't it? Robotic assisted surgery improves the accuracy and dexterity in the complex craniofacial as you can see here, reconstruction. So advanced imaging, CBCT, MRI improves diagnosis and the surgical planning for the implants and trauma as well. Laser that I mentioned earlier, CO2 and diode laser enable precise soft tissue management with the reduced bleeding. So all of this together, those innovations helps us to ensure the superior outcomes and elevate the patient care standards. When we look at the oral and maxillofacial surgery, it continues to evolve through the innovations. We have here, as I said, 3D printing, customized implants for craniofacial reconstruction. We have the virtual planning, precision in orthodontic and trauma surgeries is being achieved in a very successful way through that as well. If you look here, the evidence shows that, or the studies shows the reduced operative time by 30% with those technologies, which is very, very important for us and for the patients as well. We have robotic surgeries. It will enhance dexterity in complex procedures, and those tools are not only reduce operative time, but will improve the functional and aesthetic outcomes supported by the students in GOMS. Yes. As I said, the research is also playing a very important role in oral maxillofacial surgery. It fuels the advancement that will shape modern surgical practices. It will allow us to stay at the forefront of knowledge and continually refine the techniques and technologies that are being available worldwide, right? So definitely from this, we ensure that our patients benefit from the cutting edge care, combining the evidence-based approaches with the innovation itself. So we have specific journals that have been instrumental in advancing oral and maxillofacial surgery. So the key journals such as Journal of Oral and Maxillofacial Surgery, British Journal of Oral and Maxillofacial Surgery, will be serving as the let's look at it from by doing Zoom. Yes, so then, as I said, a British Journal of Oral Maxillofacial Surgery serves as the platform for sharing research, case reports, and surgical innovations. So those publications connects clinicians globally. It promotes the collaboration and evidence-based practices. Also, it helps to ensure the accessibility around the world for different specialists from all parts of the world. So as I already mentioned, yes, so we have also different associations, and basically those journals that I have mentioned are a part of these associations. So we have International Associations of Oral Maxillofacial Surgeons, Oral Maxillofacial Surgeons, a lot of different associations are available nowadays, right? Okay. Let's see what comes the next. So interdisciplinary collaboration is very important. So for example, if I'm having a patient with the maxillofacial trauma, I need the oral maxillofacial surgeon for the fracture fixation, isn't it? Then I need the ENT to ensure the airway management as well. Psychologist for the post-trauma counseling as well. So surgery is rarely a standalone effort. It often requires the collaboration of the multiple specialties, right? This is just one of the example, but of course there is a lot of different. We have the ethical dilemma that we need to consider as well. Because sometimes we have challenges of, for example, cosmetic versus functional surgery. There is a cultural perceptions as well. Evidence-based decision-making, transparent communications, all of this is very important. So in cosmetic surgery, we often face questions like, should aesthetics take a precedence over the function? And this will highlight the delicate balance we must always maintain. Here, the informed consent form is very important. Patients must fully understand the risks, such as nerve injury, while their autonomy and preferences are respected, of course. As oral surgeons, our priority, of course, is to integrate the clinical evidence with the ethical decision making to ensure the best outcomes that our patients can get from us. Let's unzoom it. Okay, so as I said, the cosmetic and functional surgery are distinct, but often overlap in the practice. So if we break it into down into their differences, that maybe will help us to understand. So cosmetic surgery basically focuses on enhancing the appearance of the patient, improving the aesthetics, symmetry, and proportions, right? So there might be examples such as, for example, the rhinoplasty, lifts, typically being chosen for aesthetic goals rather than medical necessity, isn't it? We have functional surgery. This will aim to, let's go back, to restore, of course, the function and correct the deformities that patient might have. So, for example, if there is a congenital defect or diseases. We said, for example, cleft lip and palate or orbital fracture repair. So basically here the priority will be the medical necessity rather than aesthetical goals. In fact, it might combine both at the same time. But the priority will be going to the medical necessity. So the patient actually needs the rhinoplasty because he is not being able to breathe properly. Due to that, he's having a sleep apnea, for example, and etc., etc. There is also important information about the training pathway. So plastic surgeon, broad training in reconstruction and cosmetic procedure within with the specialization options. Cosmetic surgeons focus training on aesthetic procedures. So the key difference will be the plastic surgery focuses on reconstruction, while cosmetic surgery centers on elective enhancements. Again, understanding those distinction ensures the patient's needs are matched with appropriate surgical goals. Balancing aesthetic desires with function outcomes are very important, as I mentioned. Yes. Communication and skills of oral maxillofacial surgery is an integral component of an effective healthcare delivery to patients. And this will include the breaking bad news. This is very important. So sometimes, for example, bad news is when the surgery was unsuccessful. Let's say, for example, a life-threatening problem, patient's death, let's say, nerve injury due to a surgery. So it's very important to be able to manage the anxious patients as well. So communicating bad news is a difficult and stressful task for all healthcare. Trust me, for all of us, even for the best surgeons as well. And for the dentist as well, by the way, right? So here the empathy will be playing an important role in addition to the clear communication. So if you say from the beginning, before the surgery, that there is those complications that might happen, so of course your patient won't be happy, but he will be at least ready for this complication. He will be the one who actually played the role in this decision making, right? How we interact with our patients defines their experience, of course. Okay, so check twice and extract once. There was a very interesting article about the extracting of the wrong tooth. So delivering bad news in dentistry, while not life-threatening, as you can see on the first picture, but can be emotionally impactful, such as the loss of anterior tooth, for example, or unexpected complications that could happen to our patient. Patient reaction will depend, of course, on the gap between their expectation and reality. So if they were over expecting something, imagining for the perfect nose after the surgery, after cleft palate, for example, surgery, they will imagine that their kid will be immediately talking, eating. There is no post-operative or post-surgical period. So then this will be a mistake from our respected doctor, of course, right? So there is something that is called a spikes protocol, and it is offering, you can see on the slide, a structured approach where S setting create a private, comfortable environment for your patient. perception. So understand the patient's view of their condition. Make sure that they understand it. Invitation, ask how much detail they want. Okay, sometimes, for example, the patient says that during surgery, I don't want to hear what exactly you are doing. Some of the patients will be saying, no, I would like to know what technique you are planning to use. You know, it depends all on your patient's age as well, culture, and etc. You need to provide them with the clear, compassionate information, which comes here under the knowledge, right? And then we have the empathy, which is the emotion. And the next one will come the strategy and the summary. So you will outline the next steps collaboratively with your patients. So using these spikes fosters trust, ensuring patients feel respected and supported, and even in challenging conversation. So how we deliver the bad news can turn a difficult moment into a chance to build trust and provide reassurance for our patients. If we go back to an interdisciplinary case, so let's imagine, for example, we have a Yemeni case or from another country. For example, a patient Ayad, 6 months old infant. There will be a challenges that will not allow us to go to the surgery. So first of all, let's see. This is Ayad. I'm just saying it out of nowhere. It's an example. It can be John, for example, right? And here we go. This is the primary condition. And we have the challenge that our patient is actually underweight. And he has anemia as well. So here the treatment plan would be the preoperative management by a nutritionist and pediatrician. Anesthesiologist will need, of course, to examine the patient, and surgical intervention at 5 months for cleft lip and at 12 months for the cleft palate approximately could be one of the approaches. In fact, nowadays it can be done from the 0 days, but we should be very careful because this will depend on the condition of our patient. Here we go. The team approach is very important, right? So oral maxillofacial surgeon will be performing a surgical procedure. Anesthesiologist will be looking at the risk assessment and airway management. We understood what is the role of nutritionist and pediatrician. So he will be basically stabilizing our patient before the surgical procedure. And then post-operative post-surgical rehabilitation means اللي بيجي بعد الجراحة. تمام؟ يعني we need a speech therapist to ensure that the patient is able to speak, orthodontist, sometimes psychiatrist as well. Sometimes we need actually to work with not only with the patient, but sometimes with their parents as well. You should read about the UNICEF story of Yemen in 2019 about Hamouda. Hamouda Hamoud, a mother in Yemen who holds her 6-month-old twins, and Ayad and Jad, while struggling through a humanitarian crisis. So Ayad, this baby, was born with the cleft palate, and he faced the life-threatening challenges as he could not feed properly, leading to choking, malnourishment. So you need to be able to know what can happen to a patient in case if he has a cleft lip and palate. So behind every case is a human story. This is a call to action to extend our skill and compassion to those in need, ensuring no one is left behind. This is a very interesting article. You can actually click on this and you will go into the article itself. I'm just giving an example of Yemen. Of course, there is a lot of different countries that could be an example. So sometimes what happens is delayed referrals, inadequate infrastructure, could pose the significant challenges. But having challenges is not the end of the world, right? We need to look into the solution. So, for example, the delayed referrals due to limited primary care training, inadequate infrastructure for complex surgeries. So here the solution could be, for example, a telemedicine. Um, for example, if you need an international or foreigners specialist experience, advice, maybe a concilium. Concilium is when أكتر من دكتور بيتكلم في موضوع المرض. تمام. So partnership with the global organizations such as WHO, UNICEF, as I said, who might be helpful for the funding and the resources as well. Also, you need, developing local expertise. So, for example, one of you will be going to training programs to another countries and will bring, for example, that experience back to our country. That will be helpful as well, right? I have a message to you as a future surgeons. Your role is very, very important in pivotal transforming of a healthcare in Yemen. You need to pursue global training opportunities, pursue the global training opportunities to enhance your skills. Look into the technologies of artificial intelligence, for example, to bridge the gaps in care. Advocate for the oral health awareness campaigns in rural communities. So, for example, if you are a dental student, under the supervision of your professors, you could, raise the awareness about the oral health and etc., right? Because you are the future, actually. Most importantly, you need to remain patient-centered in all that you do. So it's not that this surgery will bring me, for example, a good salary, a good outcome, I will travel somewhere. No, I really need to think about the patient. Not necessarily from my country. I could be working somewhere outside, but the patient would have been my goal, right? I have a question here for you that you will need to do. So, what is your vision for future maxillofacial surgery in Yemen? You can bring up the examples. I would like you to think critically and answer this question. So, what is your vision for oral maxillofacial surgery in Yemen? You need to propose a long-term strategies. So, how can we achieve the immediate and long-term goals? Okay, and your ideas, of course, will help to shape the actionable strategies. So here we have the email. What you will do is you will be sending your response to my email. By the way, you can add your questions there as well. And the deadline will be immediately after you look up to this lecture. You can group, for example, with your friend and another colleague, and the format is not important. You need just to email me. And let's go to the next slide. So this is as I said, the activity that you need to do. Here is your reading materials. I have provided all of this materials, the head of department. Okay. And again, keep in your mind that oral maxillofacial surgery is more than a discipline. It's a commitment to restoring lives. By bridging the global expertise with local innovations, we can create a brighter future for our panelists. Thank you for your dedication, dear students, to learning and excellence. And oral surgery, as I said, is more than just a profession. So we can build together a future where oral maxillofacial surgery is accessible to all. And thank you for your attention today. And I look forward to your incredible contribution to this field. Here we go. This is the Let me see if you are able to see it. So you can basically scan this QR code. I think I will zoom it for now. And here we go. This is my email and this is my social media in LinkedIn and Instagram where you can actually approach me. Thank you so much and have a great day. Again شكرا كثير لأعزاء الدكاترة والزملاء for the great opportunity and إن شاء الله أتمنى إنه الأسئلة راح تنبعت لإيميلي. شكرا.